We've all heard a lot about LASIK surgery in the last few years. It uses a laser to improve your vision so you can get rid of your glasses. It's elective. But now lasers can be used to stop someone from losing their sight completely. It's a medical breakthrough that was developed right here in Nashville, and it's being used to help a young man from halfway around the world.
And then, of course, we started to pray, and we didn't have the very big hope to get this help in our country, and so I am so happy now.
Irva and Olaf Parnemets are very religious people who found the answer to their prayers for their son Andres in Nashville. The couple from Estonia learned their son would eventually go blind because of a corneal disease, keratoconus, and their doctors at home gave them no hope. Andres even had to drop out of seminary school.
We have discovered that God's favorite method is people.
The person with the plan?
You have an area of your cornea.
Dr. Wang.
The purpose of this treatment.
This their first meeting to talk about keratoconus and how he can help their son.
We know these patients are born with irregular cornea. It's a very sharp-tipped cornea. And after much studies, we realized that the reason that they progress in disease is because they wear a contact lens which rub the tip of cornea, cause continued irritation and inflammation.
Dr. Wang spends several hours meeting with Andres and his family, and then he does numerous exams, checking measurements. But the actual laser process itself only should take about 5 minutes.
Blink. Okay, open really wide, no blink.
Can you make those letters out?
Now try not to blink.
Andres' father translates for his son throughout the morning.
There will be some moderate amount of discomfort and pain. On a scale 0 to 10, the pain is about 3.
Time to make the permanent change.
I have a special device that will hold your eyeball. Very loud sound. It goes pa 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 pa, okay? Everything's going great. We know reasonably assured that it will slow down the progression of the disease, but we also hope it will, in many cases, stop the progression of the disease. It's not a treatment for the disease itself. Patient will still have keratoconus, will still wear contact lenses. Can you see? Is there any difference? It's kind of hazy, huh?
About the same as other eye.
Oh, about the same as the other eye. Yeah. Oh, that's good, yes, because this is the worst eye.
Getting an up-close look after the laser procedure is Dr. Wang's final step before sending Andres on his way to begin the healing.
Beautiful. How do you say beautiful in
Ilos.
Ilos. Ilos.
Dr. Wang did the procedure on both of Andres' eyes, and he's done extremely well. In fact, he's even able to wear glasses, which is almost unheard of with keratoconus patients. So he won't have to wear contact lenses that could still irritate his cornea.
All the way from Estonia. How did they hear about Dr. Wang?
Another example of a small world that we live in. Andres' father is the head of the Methodist Church in Estonia, and he did a lot of mission work and had met a local dermatologist, Dr. Fields from Nashville, and that's how he found out about Dr. Wang.
Oh, okay. Neat, yeah. Neat story.
Yeah.
Well, good luck to that young man.
A North Carolina man is closer to his dream of sight tonight.
Wade Cook is recovering after a rare surgical procedure that could give him vision he's never had. 30-year-old Wade Cook has a condition known as aniridia. His eyes are covered with blood vessels and scarring that's left him legally blind. But last week, Dr. Wang performed surgery on Wade's eye in a first-of-its-kind operation at St. Thomas Hospital.
The surgery itself went very well. We're very thankful that it did.
Dr. Wang removed the blood vessels and scarring from Wade's eye, then covered it with a membrane of amniotic tissue to help regenerate the sight. 1 week after the surgery, Wade talked to us by telephone.
So far, so good. I've had a little adjustment with the stitches, but getting used to my eye watering all the time and the pain that comes with that, and trying to operate normally with just one eye.
It will take weeks for Wade's eye to heal. Then in May, he'll undergo another procedure.
And then what we're going to do is we're going to remove the membrane, and you will see this eye heal very well. And then we'll do what we call a stem cell transplantation. Transplant a stem cell which is missing for Wade. He never had a stem cell.
If the transplant is successful, Wade looks forward to doing basic things that most of us take for granted.
Possibly drive, play ball with my kids, that kind of stuff.
I expect him to be able to walk around the house, performing basic functions, and if God's willing, we may be able to get him closer to driving vision, and that will be magical.
And what are the chances that Wade will realize his dream of sight? Well, Dr. Wang says the operation offers a 60 to 70% chance that his vision will be restored.
From the News Channel 5 Network, this is Medical Mondays with Amy Marsalis, brought to you by St. Thomas Health Services.
Good evening, everyone. Glad you could join us for another edition of Medical Mondays. If you have been paying attention to medical breakthroughs at all in the past 3, 4, maybe 5 years, you had to have seen the stories about LASIK surgery to correct whether nearsightedness, farsightedness. It has been extremely popular. I don't know the specific number, how many tens of thousands of people in this country have had LASIK surgery, but quite a few, and they're still having the procedure. There have been some problems with it, and tonight we're going to talk about correcting some of those problems, and we're going to talk about a new bladeless LASIK procedure that is now available for the first time in Middle Tennessee. Very excited to spend the next hour with my guest. To my immediate left, Dr. MIng Wang, director of the Wang Vision Institute. He's a corneal specialist. He has many, many titles and a lot of experience, a lot of education, an expert in using lasers. Glad to see you again, Dr. Wang.
Good to see you.
Good to see you. Also, Teresa Thomas, who was the first patient to have the bladeless LASIK procedure by Dr. Wang in Tennessee, first patient.
Yes.
And that was just a week ago.
Yes, November 15th.
Wow, okay. And to my right, Jim Collier, who had another procedure, the custom cap procedure that Dr. Wang did on you to actually correct a problem you had from a previous LASIK procedure done somewhere else.
That's correct.
Is that right?
Mm-hmm.
Okay, we have a lot to digest here, a lot of different things to talk about. But first of all, I just want to get started with LASIK. And for people who haven't heard of it and don't know exactly what is being done with the laser to the eye, to the cornea, can you just explain in layman's terms what happens?
In the LASIK procedure, there are two parts to the procedure, Amy. The first part is actually using handheld instrument called microkeratome blade to make a corneal flap. Once the flap is made, that's the manual part. And then a laser is followed with correction. And in terms of accuracy and safety, majority problem actually come from the manual instrument part. Majority of the sight-threatening complications, as we will see later in the talk, come from the manual cutting of a corneal flap in preparation for the laser treatment. So as you look at the history of the technology, it starts with radiokeratotomy or by hand.
Right.
Now partially hand, partially laser, the conventional LASIK technology. Now we are moving into a new era in technology, all laser, that completely eliminate surgical blade.
I was going to say, will that make the surgical blade obsolete then? Will the LASIK, as we've heard about it for the past 3, 4, 5 years, that's going to be old technology?
Yeah, the conventional LASIK technology will be an old technology, and we will be able to basically perform the whole procedure without having to have any surgical blade at all, therefore raising the precision and safety level to the next level.
In our just last 30, 40 seconds here, kind of the message you really want to drive home to viewers, I take it, really what I'm hearing you say is that LASIK is just a great thing, it's elective, but you really want to make sure you go to the right person because of the safety issues involved, which you know all too well, Jim. Jim's been pretty quiet over here, but you know that from experience.
Yeah, definitely.
Yeah, I think probably two main take-home messages. One is the technology is here now. We can perform surgery without using any surgical blade and all laser. That represents a natural progression of technology. But most importantly, as all high-tech technology, it has to be used properly. The doctor, surgeon has to have the right training, and patient has to select properly and use this high-tech technology properly to benefit us.
All right, thanks, Dr. Wang. Thank you.